Alzheimer's disease, once which was less common, today it is becoming more and more common in this world. It is known as senile dementia also. Let's see the definition of Alzheimer's disease. Definition is that it is progressive disease that destroys memory and other important mental functions. Brain cell connections and the cells degenerate and die. Because of that, memory loss occurs and the important functions of the brain also are affected. So it is a प्रोग्रेसिव डिसीज़, दैट मीन्स ये डिसीज़ जो है डे बाय डे बढ़ती जाती है और इसमें क्या होता है, याददाश्त इंसान की कम हो जाती है या बिल्कुल ख़त्म हो जाती है और इम्पॉर्टेंट मेंटल फंक्शंस भी इंसान के ख़त्म होने लगते हैं. और ब्रेन सेल्स क्या होता है, इसमें ब्रेन सेल्स एंड ब्रेन सेल कनेक्शंस are degenerating due to the age factor and the brain cells die and destroy the memory. What is the incidence of Alzheimer's disease? Incidence is more than 1 million cases per year in India. So in India more than 1 million cases occur every year. The causes of Alzheimer's disease. The causes of Alzheimer's disease, it is caused by abnormal buildup of proteins in and around the brain cells. One of the proteins involved is called amyloid, which form plaques around the brain cells. Another protein is called tau and its deposits form tangles within brain cells. Although it is not known exactly what causes the process to begin, the scientists say that it begins many years before the symptoms appear. So the two types of proteins they play a major role, जो कि पहली है एमिलॉइड, और एमिलॉइड क्या करती है, वो ब्रेन सेल्स के चारों तरफ एक लेयर बना लेती है जिसको कि प्लाक कहते हैं. और जो दूसरी प्रोटीन है उसका नाम है tau. tau सेल के अंदर, ब्रेन सेल्स के अंदर जमा हो जाती है और इसका क्या कारण है ये कोई भी नहीं बता सकता है. और साइंटिस्ट कहते हैं कि ये डिसीज़ बहुत साल पहले ही शुरू हो जाती है पर्सन में, लेकिन उसके लक्षण बाद में पता चलते हैं. There are risk factors also. It is not known clearly what triggers Alzheimer's disease, but several factors are known to increase the risk of developing this disease. Number one factor is age. It is the most common factor and significant factor. It is likely to occur in the people who are more than 65 years old, but it is in the people who are under 65 at the rate of 1 in 20 people. So it's not necessary that Alzheimer's disease occur only in 65 years old people, but it can occur below 65 years also, but it is lesser than the first one. Gender. Which gender is more likely to get Alzheimer's disease? Number one, women. Women are affected more often than men. Family history of the patient is another risk. The genes which is inherited to the children from parents or grandparents are responsible for Alzheimer's disease. So we can say that it can be hereditary disease also. The people in the family have developed dementia, they must seek medical attention and genetic counseling for information and advice about the chances of developing Alzheimer's disease in the old age. So the people who get dementia, they must go for the medical checkup and they must ask the physician what are the chances of developing Alzheimer's disease in the old age. Then the people with Down syndrome are susceptible to Alzheimer's disease, and they are at the higher risk of developing this condition. This is due to the genetic fault that causes Down syndrome, which can also cause the amyloid plaque building in the brain. With time, it can lead to Alzheimer's disease in some people. The next is the head injury. The people who get head injury, they are at the higher risk of developing Alzheimer's disease. Next is cardiovascular diseases. The people who have had cardiac disease, the research studies show that several lifestyle factors and conditions associated with cardiovascular diseases can increase the risk of Alzheimer's disease, such as smoking, obesity, diabetes, hypertension, high cholesterol level, alcohol. Then sometimes lifestyle people who are active physically, mentally are at the lesser risk of developing Alzheimer's disease. So the people who are active throughout the life and they don't have the sedentary lifestyle, they are at the lesser degree of developing Alzheimer's disease. Then prions. Some scientists hypothesize that prions, tiny infectious particles made of protein, may be involved in Alzheimer's disease by infecting the brain. So these primers, what are the prions? Prions are the infective particles made of protein, and they can be involved in Alzheimer's disease. And how it happens? By infecting the brain. So after seeing the causes and the risk factors, now we will see the pathophysiology. Pathophysiology, the beta amyloid deposition and neurofibrillatory tangles lead to loss of synapses and neurons, which results in gross atrophy. Gross atrophy means shrinkage of the brain of affected areas of the brain, typically starting at the mesial temporal lobe. Two neurotransmitters seem to play a role in Alzheimer's disease, that is acetylcholine ACH and glutamate. ACH activates muscles and helps with arousal, short-term memory and learning. People with AD have less ACH. So in Alzheimer's disease, the ACH becomes low. Deficiency of vitamin D in the blood also increases the chance of developing Alzheimer's disease and other forms of dementia. More stress exacerbates Alzheimer's disease, which causes rapid development of pathology and loss in cognitive functions. What are cognitive functions? The thought process. The person thinks and makes the ideas in the brain, that is known as the thought process. Now we will see the stages of Alzheimer's disease. There are 7 stages of Alzheimer's disease. Stage 1. In stage 1, no impairment occurs. During the phase 1, Alzheimer's disease is not detectable and there is no memory loss or other symptoms of dementia. Next is stage 2. In stage 2, very mild symptoms of decline in memory can be seen. In stage 3, there is mild decline in memory. In stage 4, moderate decline in memory. In stage 5, moderately severe decline in memory. and stage 6 there is severe decline. So person becomes very forgetful in the stage 6, and in stage 7 very severe decline.